My name is Janet Larson-Meyer, and I'm happy to have this opportunity to be with you today for this fascinating interview with a nationally renowned addiction recovery expert who practices family medicine in Phoenix, Arizona. Dr. Rick Sloan has dedicated his life for the past 15 years to helping people from all walks of life recover from chemical addictions, including CEOs, politicians, and homeless people. He's recognized as an expert in treating all types of addictions, and he has some powerful insights to share with us today, including who becomes an addict, new deadly drugs on the scene, it's not just opioid abuse anymore, signs to look for when you suspect someone you know may have a drug problem, what makes Dr. Sloan's addiction treatment unique and effective, how CTFO CBD oil can help change the future outcome for recovering addicts, and more. Now, before I introduce Dr. Sloan to all of you, let me tell you a little bit more about this remarkable man. Dr. Sloan graduated from the University of Colorado Medical School and trained at St. Joseph's Hospital in Phoenix, Arizona, with his last year as chief resident there. He's been a medical director of a hospital and has served as chief medical officer for his addiction clinic for 9 years. Dr. Sloan served on the Arizona Governor's Substance Abuse Task Force in 2016, helping write legislation to help Arizonans in need. He's been a leader in his community, state, and nation, and he's been ranked number 11 among addiction medicine providers in the US. He's one of only 2 providers who offer outpatient benzodiazepine detoxes in the United States and Canada. People suffering from chemical addictions travel from all over the world to seek care from this great physician and humanitarian. But he doesn't do it alone. Dr. Sloan's wife, Valerie, also plays a pivotal role in his practice. Together, they've successfully recovered over 20,000 patients. Just think about that. That's an astonishing number of people that Dr. and Mrs. Sloan have given a second chance at life. Ladies and gentlemen, it's now my pleasure to introduce my friend, CTFO associate, and this great physician and healer, Dr. Rick Sloan. Dr. Sloan, welcome to our webinar.
Thanks for inviting me, Janet. I wish I could be at your Success Saturday event in person, but the schedule of my clinic just wouldn't allow it. Sorry about that.
Well, we totally understand, and we're so grateful for your time today. Before we begin this interview, I want to be clear with our viewers that we are not making claims of cures here, nor guarantees that everyone will experience the same results being shared, but we will be touching on Dr. Sloan's experience with CBD oil, both personally and professionally, and he'll be sharing why he recommends it to many of his patients. So let's move on because we have so much to cover in a short period of time. Dr. Sloan, please tell us about your thriving Phoenix practice and your specialty in treating various types of addictions.
Well, I've been, like I said, I've been treating addiction for about 15 years. And, you know, in this 15 years, things have definitely progressed, and we've gotten to know the brain better and better, and kind of how it works and how it responds to different things. But we actually offer a unique ability for our patients to actually detox off of very dangerous drugs in an outpatient setting, which is actually pretty rare. Most people, when they think about detox, they think about going to an inpatient setting and sitting in there for, you know, anywhere from 8 to 60 days in a foreign place, where we can actually help detox them a couple hours in our clinic a day, along with a sponsor, and actually then send them home, and so they can actually rest comfortably in their own bed, in their own environment. We think that this helps a great deal as far as the comfort and care that we offer, for sure.
That is so incredible to think that you can get people well along their way with a recovery in just a few days. You know, I always thought that when you're recovering someone who's an addict, addicted to dangerous drugs, that they had to be supervised constantly, at least initially, but you've proven that not to be the case.
That's true. We educate our sponsors that actually are with the patients 24 hours a day, and we give them very targeted comfort medications that actually help them stay calm and relaxed during the detox process. sometimes our patients have virtually no symptoms when they're detoxing. It's kind of amazing, really.
Wow. Does treating them on an outpatient basis, Dr. Sloan, lower the cost of treatment and also lower their resistance to wanting to be helped by you?
Yeah, so, and I don't know the exact numbers for inpatient places. I'm sure it ranges from anywhere from $30,000 to over $100,000 for even a 30-day stay. But our prices are well less than a third of that cost. And the patients get to stay with family and things like that. So they're not, they don't feel like they're abandoned, or, they still have time to think. And the process that we do is just trying to get these drugs out of their brain. That's our main goal for this purpose. And we just feel that them going home and able to kind of be around loved ones just helps a great deal.
I know you and I have spoken before about this action of getting the drug out of the brain as part of the initial detox experience. Can you share with our viewers what happens to the brain of someone who is chemically dependent when they are without that chemical for a short period of time? What's the response that happens in the brain?
So what happens, especially, and we can just take opiates, for example. I think they're probably one of the most studied because it's the biggest problem right now in the United States. But what happens whenever people are using opiates for long term, number one, the endorphin system in our brain kind of shuts down. Our dopamine response is muted, and the output of the part of the brain called the limbic system is almost kind of shut down. And whenever we remove, let's say that the opiate is acting like a lock on the limbic system door, whenever we take the opiates away and we remove the lock, then the floodgates are open, and you have all this norepinephrine and epinephrine and dopamine coming out of the system in great amounts. The patient's not used to having anything in there like that, and all of a sudden now they're being exposed to all this epinephrine and norepinephrine. The brain doesn't know what to do, so it starts experiencing withdrawal symptoms in almost every organ system of the body. Things like, shaking, sneezing, muscle cramps, diarrhea, nausea, vomiting, anxiety, insomnia. So every imaginable organ system is affected. So
do you get different kind of withdrawal symptoms with different drugs?
You definitely do, because these drugs act in different parts of the brain. So benzodiazepine, withdrawal symptoms are much different and actually much more dangerous than actually opiate withdrawal. Being
that you're one of the few people who can actually detox someone from benzodiazepine, who would prescribe what is it called? I'm sorry, I'm not saying it right. Benzodiazepines.
And these are drugs like Xanax and lorazepam, Ativan, Valium, diazepam. Those are the more common names for them. Basically they're prescribed for a whole plethora of problems. They were originally used for seizure medications, and they found out that when people took these, they actually felt very calm. So they really prescribed for like insomnia, and they're also prescribed for anxiety a lot of times. So they're actually prescribed by a lot of different physicians.
Wow.
So,
certainly I and everybody who's watching this have heard so much about the opioid epidemic and the tragic deaths that are associated to that substance. But lately it seems, doctor, like I've heard about a lot of other deadly drugs. So what are the most common and the most dangerous drugs that you treat patients for today?
Well, in the opiate family, fentanyl is definitely the top drug that we have a problem with. And, if you think in terms of strength, everybody knows kind of what morphine is. Morphine and heroin are virtually almost the same kind of strength. Morphine might be a little bit stronger as far as analgesic properties to heroin. Mm-hmm. So they're kind of close to about a 1-to-1 ratio. Well, fentanyl is about 5,000 times stronger than morphine or heroin. And then there's a sister drug to fentanyl called carfentanil, and that is being manufactured mainly in, I believe, China and Mexico, and it's 10 times stronger than fentanyl, so it's 50,000 times stronger than morphine or heroin. Carfentanil is so dangerous that if you've ever seen on TV where police are actually now kind of gowning up and gloving up when they look at drugs, because even getting this drug on their skin could create problems for even the police officers.
Oh,
So
that is just incredible.
it's
Incredible.
So
How many, I'm sorry, how many patients do you treat on an average in a day?
Between 20 and 30 typically, and we typically do in our clinic between, I mean, it varies, but I'm probably on the average 3 to 5 detoxes per month in our clinic.
Wow, that is amazing. I understand that drug abuse affects all demographics, but does it affect some more than others?
There's been some studies that show, believe it or not, that male gender has a little bit higher risk. People with aggression or anger disorders, people with social phobia disorders.
Mm-hmm.
But really, if you really think about it, these drugs really affect every demographic in any situation. It doesn't matter if you're the richest person in the United States or the poorest person, it can affect you. And it's just because of the way how our brain responds to these specific psychoactive drugs.
How do people usually wind up getting addicted to a drug, Dr. Sloan?
Well, I mean, continued use when it's not needed, number one, is what happens. But the way people get kind of trapped into the situation, and so I think for the lesser part of my patient population, it's more recreation, more kind of experimentation. And this is, more generally in the younger population, in even down as low as 11 and 12 years old, people are starting to start using heroin, and and it just kind of grows from there. But I've seen adults use it as well. So I'd probably say 30-40% of my patients are from that demographic. The other, what I'm seeing trending now is, 50-60% of my patients are, patients that have chronic pain issues and that have been, given opiates for years and years and years when they're not really working, and they keep giving them more and more strength, higher strength. And then, as time goes, the laws kind of change and the DEA starts coming down on some of these pain doctors. And then all of a sudden they're not prescribing them these pain medications anymore. And their primary care doctors aren't prescribing them. So they're really forced to go to the street. And unfortunately, the cheapest opiate on the street is heroin. And now, unfortunately, a lot of the heroin is being disguised as fentanyl. So the fentanyl is actually, people think they're getting heroin, they're actually getting fentanyl or heroin that's laced with fentanyl.
That's just incredible. What types of behavior can we look for in someone to know whether they have a problem with a illicit drug?
And I think the biggest problem in patients is or a change in patients is lying, and then lying upon lies. That's for sure. Manipulation. If you're seeing your child or your spouse or your parent becoming more manipulative, if they have more or different friends, they're hanging out with different friends. If they want more alone time, if they want to go out more, those kind of things. Also aggression, verbal, aggression for sure. Those kind of things are definitely ways of looking. But I can tell you, I've detoxed a lot of 18-year-olds off of heroin, and who have started when they were 12 and 13 years old. And a lot of times their parents, and they're very good parents, they say, they really didn't know there was any kind of a problem until they were, 17, 18 years old, or when the patient actually told their parents there was a problem. So, they can hide these, people hide this very well. I mean, there's a lot more, opiate dependent people than people even really realize, for sure.
Last year, if we kind of segue into how you actually started working with CBD, you had some intense neck and knee pain that you were desiring some relief from. So somebody introduced you to CTFO CBD, and that was kind of the catalyst into exploring and actually personally using CBD before you introduced it into your practice. Am I right?
That's correct. Yes.
So tell us a little bit about, let's start at the beginning with your neck and knee pain and how, and what you experienced using CBD.
Well, I've always had chronic neck pain. Well, since I was, younger because I broke my neck when I was in the service, and it never really got fixed correctly. I was always an athlete and found that I couldn't do what I wanted to do when I was younger just because of the neck pain. But I was an avid runner for a long time, and that kind of messed up my knee as well. But over the years, it just keeps getting worse and worse and worse. And I never wanted to go on to opiate pain medications because I know what happens doing that. So, when actually my wife's friend, Lori Nelson, said, "Hey, you should try this." I know Janet very well, and she's kind of introduced me to this, and I've studied CBD and marijuana and every other aspect of more naturopathic type things.
Mhm.
But, so I said, I'm going to try it. And I think I tried the 750 milligram dropper first, and it did give me some relief. I finally went to the 1500 milligram, and I started doing it twice a day. And, I was astonished not only at how better my knee was getting and my neck, but I was also astonished at how much less anxiety I had during the day and how much better I was sleeping at night. So it was kind of a twofold thing for me. It really helped my pain, but it also helped my daily anxiety and stress and just feeling comfortable with myself, so it's really has made a difference in my life for sure.
Yeah, I share that with you, Dr. Sloan. I was turned on to CBD to deal with pain and inflammation from some motorcycle accidents, and then I accidentally discovered the benefits of additional focus and putting to bed my addiction to sugar and sleeping well at night when I've had problems with sleep even when I was a child. So all those things surprised me. I wasn't signing up for that, but sure, I'm sure glad to get those additional benefits. So you start using CBD, you get these benefits. At what point do you decide that you're going to start introducing it to your patients in your clinic?
Well, because I have a unique situation and I do drug screens, one thing I wanted to do first, and that was I did a drug screen on myself to make sure that I didn't have any THC because, I don't really, I'm a biochemist as well, and I understand that something that has less than 0.3% THC in it is what that is, but I don't know how it was going to register on a drug screen in real life. So I wanted to make sure. So I actually did a drug screen on myself, and I sent it to a lab where they did liquid chromatography, which is this type of drug screen would actually hold up in court. And my drug screen was negative, and I had been taking the CBD oil for about 2 months. So number one, I was very happy because I didn't want to give something to my patients that all of a sudden, okay, now all my patients are starting to show up with THC in their urine. Here, and I'm trying to get them off of drugs, and so that was one thing I did. But then after I did that, I started giving it to my pain patients first off, because that's why I did it. And a lot of the pain patients, because that's why they were doing opiates in the first place. But a lot of them relieved a lot of their pain, and a lot of them are definitely still taking it today, for sure.
That's great. And you bring up a good point. A lot of people seek opioids for pain, right?
That's correct.
And then opioids don't even address the inflammation. Is that correct? CBD addresses and benefits people on a pain measurement and on inflammation, and opioids really more towards pain, correct?
Yeah, so opiates really kind of mask pain. They don't really help fix the pain, where CBD does. CBD gets rid of the inflammation and it helps it in that direction. And that's, over time, whenever we have arthritis and whenever our bones are getting older, that's what happens. We get this arthritis. We get this natural inflammatory process in our joints that hurt. It hits the nerve receptors and it makes us feel pain. And so CBD helps reduce that, which is really good.
Tell us, we talked a little bit about some of the symptoms that someone goes through when you're taking them through a withdrawal, a recovery experience. You have shared with me some unbelievable stories, like at all ends of the spectrum of taking someone who's in the worst of circumstances to on top of their game. You and I we've talked about this on a previous interview, and we now have a mutual friend that I brought to you. But you have so many stories to share. Can you get to some of your favorites and share those with us now?
Well, I have so many, so many. I wish I should write a book, probably. But there was we can talk about our mutual friend. I mean, so she had a problem with opiates because of an accident, just like a lot of people do, and not really even realizing that she was even dependent on medication at all until she tried to stop. Then all of a sudden she started having these really crazy, weird flu-like symptoms that became like 10 times worse than the flu. So then she finally realized that, hey, I think I'm having a problem with these medications. And so, during her detox, she was definitely taking CBD oil, and it was definitely relieving a lot of the pain. A lot of opiate withdrawal can come out as pain. This is kind of what my belief is. I believe that, the withdrawal kind of hits almost every single organ system in our body. And, we have an endocannabinoid system in our body that hits almost every organ system as well. And we've been depleted from CBD for such a long time that when we reintroduce it, it actually makes things just work better. So I really believe that during these times where people are actually going through withdrawal symptoms, CBD actually goes into every single organ system and actually helps it a little bit better. So a lot of these symptoms are just mitigated just by that alone. I mean, we do have a lot of comfort meds that we give to patients that actually help, turn the limbic system down a little bit. But CBD just kind of helps round everything off and makes them feel just better. It just makes them feel a little bit better about themselves. Kind of how whenever you and I started using it, I got more for my money than I imagined, because not only did it help my pain, but it helped my anxiety. Even with benzodiazepine withdrawal, that's the biggest problem, is the anxiety and the insomnia. Well, my first line of therapy for them is CBD, because it really, really helps the anxiety. It helps that endocannabinoid receptor in the brain that actually is helping people, control their GABA receptors a little bit better. So
You've actually even helped a pregnant woman. I know probably lots of them, but I remember you sharing one story of a pregnant woman that you've helped recover, right?
We have helped a lot of pregnant women actually in our clinic. I'm the only person I know of in the whole United States has ever, in an outpatient setting, detoxed a pregnant woman off of benzodiazepines. And, her baby is 2 years old now and perfectly fine. In fact, I just talked to her husband just like 3 days ago, and she's still doing well. She used CBD throughout the entire process. So, her benzodiazepine withdrawal, we have a benzodiazepine withdrawal scale, and it goes up to 76. And, usually we like to have people down under 10 before we kind of release them back home. And with a negative drug screen, after the third day she was there, her benzodiazepine withdrawal scale was like at a 3. And that was because in my mind, because she was using CBD along with the other comfort meds we were giving, plus the medication that was targeted to actually help get the benzodiazepines out of her brain.
And then I remember the story about that young lady who I think collapsed with an anxiety attack in your clinic, right? And that you had your own personal 1,500 milligram CBD oil handy. Am I right? Am I remembering that right?
Well, she wasn't a patient. She was my daughter, and she had a really bad anxiety attack in my house. And I gave her a 50 milligram tincture, just one tincture, and her panic attack was gone in probably about 3 minutes. In fact, it was it went away so fast that my wife and I were actually thinking she was just kidding. But she actually said it really was the CBD, and she still takes CBD to this day too. And it's helping her sleep, it's helping her anxiety, and just overall well-being feeling. It's so yeah, that's really close to my heart, the one of my daughter, so for sure. But
yeah, I remember you sharing that one with me, that it was really an extreme attack. And is there something about us as we get older that anxiety becomes more of an issue for more people?
Well, I think as we age, I think our brain changes. I was talking to a patient actually from Canada who's actually going to be coming down here next week to detox off of benzos in my clinic. And he's actually a diplomat from Canada, which is pretty crazy. He was a diplomat in Thailand for a long time, but anyway, he's coming down, and he told me that when he was in Thailand, younger, he used to take a medication called clonazepam, which is a benzodiazepine, and he said he was on it for about 6 or 7 months, and then when he came home, he got off it and he had no problem. And lately he's been having a little bit more stress in his life. He's now in his 50s versus back then when he was in his 30s. And he said he's been on the clonazepam for about 3 months. And all of a sudden, when he stops taking it, he has these horrid withdrawal symptoms. And he asked me why is that happening? I said, well, because your brain changed, you know, and the responsiveness of your brain to that drug is different now than it used to be.
Mm-hmm.
So that's the issue, you know, and it's, you know, some people can take benzodiazepines or opiates and get off of them and not have a problem. And some people take them and they just can't. And it's because of the response that their brain has to those drugs.
So in your practice, you do conventional prescription medication, and you use CBD as an adjunct to that.
That's correct.
Is it for most of your patients that you find that that's appropriate, or some of them? What does that look like?
We try to use it on all of them. And for the most part, we get positive results. You know, it's hard to say. I mean, because it's, you know, if I use it on somebody and they have a good detox, is it because of the CBD? I mean, what if I wouldn't have used it? Maybe that, you know, I don't, it's hard. It's hard to question to answer, but I think it's worth it because of what it did for me. And that's why, you know, I'm a believer in it. So you know, it just seems to me that since I've been using CBD, our detoxes have just been a little bit more mellow. And I do think it definitely helps.
Have you talked to other doctors about CBD and gotten their take on it, Dr. Sloan?
Yeah, I mean, there's, you know, I think that we need more education. I think, you know, not all doctors are on board with this, and I think that over time they're going to be. A lot of addiction doctors are definitely on board with it, because I think it's just our job to understand how the brain's affected by different things. So yeah, I talk to doctors all the time about CBD, and some don't believe in it, and some give it a chance, and some believe in it. So, but I think over time, more and more physicians are going to be accepting of this drug. I mean, it really is a drug, and you know, I always ask my wife, you know, why do we have an endocannabinoid receptor, and why do we have this system in our body if we don't have CBD to put on it? You know, it's something that we need.
Mm-hmm. That's a great point.
We used to have it in our system hundreds of years ago, but then it became restricted and it was completely out of the country. And now we're reintroducing it. And I think it's just something that we just actually need. It should be like, it's like almost to me like it's an essential part of our diet. You know, it really is. It's just, that's just the way I think.
This is no modern day breakthrough. This has been, we've had it for thousands of years. Actually, people have used CBD, right? And we used it here in the United States a few hundred years ago. Am I correct?
Yeah, I think that it wasn't. I think when it first became criminalized was like in 1900. I mean, you know, so it was definitely used. So, you know, a lot of the, I collect one of my collection. I'm a collector. One of my collections is collecting old medicine bottles, and I have a really old. I can show it to you. It's right here. It's that thing. Can you see that?
Yeah.
Okay. Yeah. So anyway, it's an old medicine cabinet from the 1800s, and
wow.
But there's a lot of bottles in there that are just straight up marijuana. I mean, they're just bottles of marijuana. So we've definitely used it in the past. We know there was a benefit from it. I think it was a political problem why it became illegal in the first place. But hopefully, you know, with good science and people with open minds, I think it's going to be I think it's going to be one of the biggest breakthroughs in medicine in this century. I really do.
Right. That's very exciting. You mentioned CBD as a drug, and the FDA really doesn't have any regulatory power over CBD. Explain the reference to drugs for us, if you could.
Well, I mean, it does, you know, a drug to me is anything that we put in the body that has a mechanism, especially in the central nervous system. So, and maybe it shouldn't be classified as a drug, but I think it's just a fine line of the definition. It's whether you say tomato or tomato, it's just it does something to us. It really is, it's an active ingredient that we use that actually changes a physiological function. To me, that's a drug. So we have a lot of, you know, herbs and things that do the same thing. Are those drugs? In reality, yeah, they really are. I mean, they are a drug in the way I think of drugs.
Okay.
There's a physiological response from taking them. So there's, caffeine is a drug. It is.
Okay, I get it. Thanks for that clarification.
Yeah.
Should we as associates here at CTFO, when we see somebody that has a drug problem, and I have to tell you, since I've met you, maybe my awareness has been heightened, but I do know people now that I didn't know before have a real issue. Should we as associates approach people with the idea that a bottle of 1500 10X Pure is going to turn their whole picture around? Or is the responsible thing to do to encourage that person to get help and to use this as an add-on to their protocol with the support of their doctor? What are your thoughts on being responsible and serving the best interests of the people we meet with a problem?
Yeah, I think that if there's a problem, if somebody's having a substance abuse problem and it's affecting their life, then I think that number one, it's really, really hard to come off that by yourself. It just really is. You just need somebody that is professional that can actually help you do it. And, one thing in my clinic that I always try to do with my patients is I try to make them feel comfortable. I try to get them to understand that they can trust me and that I trust them. And I think when we get there, then I think that's kind of why our clinic is so successful. People feel very comfortable in there. But trying to get somebody off of a drug that is not, that they don't know what they're doing, it can be very dangerous. And there's not one silver bullet out there that's just going to cure everything. But this definitely helps. It's definitely a helper. I use a lot of drugs, to help people stay clean. But even those drugs that are extremely powerful, it's just another tool in the toolkit. I mean, you need the whole toolkit. CBD is definitely a tool in my toolkit. I definitely use it.
Yeah, well, this has all been so fascinating, and we've covered a lot of information about how substance abuse begins and who's affected by it, and the conventional and non-conventional resources that can help to really change the future outcome for people who are ready to take a giant leap towards recovery. And any way you look at it, Doc, drug abuse is a devastating condition that ruins lives for the addicts and those who care about them. You've given us a look into addiction and treatment, and I think we all have a greater understanding now of how to identify signs of addiction and support addicts in their recoveries, knowing our products hold one of many keys to unlock the chains of addiction. So I cannot thank you enough for agreeing to doing this interview and for the ongoing sacrifice that you make to save lives, one precious soul at a time. So I know all of us at CTFO wish you much success in the days to come, and we're honored to have you as part of our family, Dr. Sloan.
That's awesome. And before I go, I just want to let you know that me and my wife are kind of starting our own venture. We've actually started a company. In fact, we actually started the company today. It's called AMF. It's Always Moving Forward Medical. So AMF Medical. And we just are really going to try to be stellar people in our community, and we really want to help people get off drugs.
Oh, that's outstanding, and we'll support you. And we thank you so much for all you do and all you contribute to the community, and my love to Valerie.
All right, very good. Thank you very much for having me.
Thanks so much.
All right.
Good night for now.
Good night. Bye-bye.